We will have breakout sessions. I'll go through that in a few minutes. I'd also like to acknowledge my co-chairs for this conference, Anil Rustagi, who's my division chief, Wei-Jing Sun, Jeff Drebin, and Jim Metz. And we also, next door to us, will have the Can Prevent Colorectal Cancer Conference, and that's where essentially the risk factors and risk modification for colon cancer will be discussed, along with our new West Philly screening program, where we have a navigator program due to benevolence of one of our donors who set that up so we can take in patients who don't have the means to get colon cancer screening. At this point, I'd like to just remind everybody that there are a bunch of exhibits. You see the ones around the room here. There are also other exhibits in the other rooms. They're from the Abramson Cancer Center and outside services. The ACC is presenting cancer education, coping with emotions, development, and managing physical symptoms, and speaking to a nurse. Also, Penn Home Health Services is here. Penn Behavioral Sleep Medicine is here. Colon Cancer Alliance with the Undy 5000 is here. Colon Cancer Coalition with the Get Your Rear in Gear run is also here. Everyone likes that one better than the Undy 5000. We won't tell CCA that. Cancer Support Group Community of Philadelphia, the Faces of Cancer Project, Good Shepherd Penn's partner, Penn Therapy and Fitness, Lynch Syndrome International Group, OncoLink.org. We'd also like to acknowledge our support for this program. There's an educational grant provided by OrthoClinics Diagnostics and also by Lilly USA, and also support from Toll Brothers, Brian Efren, the H&H Kravitz Charitable Trust, also directly from Barbara and James Kravitz, Dr. Barbara Kravitz herself, and Bunny and Philip Kendall, and Raymond Haupt. Also, a reminder to everybody at the end of the day, you will receive 3 feedback forms that we would like you to fill out. One is an overall conference evaluation, one is a needs assessment for future content for conferences, and the other is a chemotherapy survey, which may be applicable to you. Your feedback is really important to help us make sure that this remains patient-oriented. I'm now going to have a long disclaimer and a number of things I have to go through with you. There are going to be podcasts, slide presentations, and photos, which may be found later on, and the information is in your packet at pennmedicine.org through the Abramson Pancreatic GI Cancers Conference page. Also, you'll find a series of blog posts related to this conference and other support information, including comments from survivors on pennmedicine.org. All you have to do is click on the blog icon, and that will take you to the Focus on Cancer blog. And you can also directly go to OncoLink to obtain additional information about the individual cancers and support information. Also, if you tweet on Twitter, you can use that throughout this conference at tag GI Cancer ACC, and you can also go to Facebook and find the ACC. Now, this is the complicated part. Anybody colorblind in the audience? All right. If you don't want to be included in a video or have your picture taken, you have to have a red name tag that will let the photographers and the videographers know that you don't wish to be included in any of the pictures. You can get those at the front sign-in desk. So if you don't want to be photographed, a red name tag. Blue name tags, you will be photographed. For the most part, we will allow questions after the presentations. If we could allow the speakers to get through their presentations, it would be helpful. There are microphones spread throughout the room. It would be most helpful if you use those, as it can actually be pretty hard to hear the questions up here on the podium. Also, because this is video recorded, if you do ask a question, please make sure that you filled out a HIPAA release form, because the question you ask may or may not be construed as being applicable to you. The forms are also located at the check-in table. If you don't wish to ask your question, you can write it down and then hand it to one of the facilitators. There will be some people walking around during the question and answer periods, and they'll hand it up to us here at the podium to ask the question for you. We're going to try and keep all of our speaker introductions brief. There are bios included in your packets so that you can review those, and there are QR code scans as we're becoming more and more technologically dependent, to take it to the Cancer Center website, and you can look at more complete profiles there. For everyone in this room, we'll remain in this room most of the day, but there will be a breakout for the esophageal and gastric cancer group, and that will be in the bowel room, which is just right around the corner. There will be some facilitators to help direct you to that area. During lunch, the doors to the other conference rooms will open, and there will be some music and line dancing if you feel like dancing during lunch. After lunch, the doors will close, and you'll be able to move back to your breakouts. The breakouts will either include a number of different sessions, one for African Americans and the other for Latinos. The African American session will be 1 to 3 p.m. in the Grand Salon. The Latino session, which was originally scheduled for 1 to 2, it's important to note, has been changed due to a scheduling conflict to 12 to 1, and that will be in the Marion room, and that will also include lunch in that room. There will also be other workshops for support groups taking place at 1 and 2 p.m., and those are, again, in the agenda book that you have. Please feel free to move about during the afternoon sessions. It shouldn't be any any problem for anybody. And then please, at the end of the day, remember to drop off the questionnaires. If you'd like some Reiki or massage, those are available during the conference. I don't know if we have, yes, we do have in the corner there, sorry. See you. They're in each room and in the corner in this room. Please stop by and sign up for a time so that there isn't a crush at one time or the other. Because we know that nature will call, the washrooms are right across the hall. The male and female ones are separated. You'll just have to go down a little bit farther for the female washroom. 1:45, there will be a live web chat on OncoLink. You can log in and follow along via the wireless that's in here. That chat will be moderated by Caroline Vichani and Gloria DeLulu, who are our nurse practitioners here, and we'll include some other people that you know, including Bruce Giantonio, Jim Metz, Liz Dunphy, Katrina Claghorn, and Christina Bach. All right, I don't know if Chi Dang is in the room right now. We're probably running a little bit ahead of schedule because those 15 minutes of announcements only took 10. At this point, I'll introduce Trish Gambino, who I think a number of you know. She's our oncology nurse navigator and absolutely invaluable to the smooth functioning of the entire GI onc program. She's going to lead a panel on inspiration from survivors.
Good morning. We're currently waiting for 2 more of our panelists to arrive, but in any event, we'll go with the flow. I truly am so honored to be the moderator for this panel of distinguished guests. I know as they share their stories with all of you, it will inspire not only patients, families, and caregivers, but we who are the professionals who take care of patients with cancer. I know their stories will inspire us, the professional caregivers, as to why we do what we do every day. And it keeps us focused on what is really truly important, and that is the patient experience. So I'm going to begin our panel with an introduction to Gail Slappy, and I've known Gail for many, many years, and I know that she has much to tell you all.
Good morning. It's glad. I'm a little nervous. I don't normally speak in front of a large crowd of people. So first, I'm gonna just take a deep breath and close my eyes. I'm just glad to see all of you here. I see that you have an interest in the GI cancer at the Abramson Cancer Center. And as it was previously mentioned, I am a GI cancer survivor. Not only am I a GI cancer survivor, I'm also a breast cancer survivor. So I'm a 2-time cancer survivor. And I think between my cancer experience and the GI experience, it was about maybe 15 years. And both of my treatment and therapy has been at the University of Pennsylvania Hospital. When I was first diagnosed with breast cancer, the Abramson Center wasn't in existence. However, at the University of Penn Hospital, they had what they called a group of doctors, nurses, therapists that were there to help not only diagnose my cancer, but to be supportive and to help me through it. Dr. Fox was my primary doctor. Then, recently, which was about 18 months ago, I was diagnosed with esophageal cancer. And it all started with a fullness in my throat, and it seemed as though I could not swallow. So I thought it was heartburn. So I was kind of diagnosing myself. But one night I was in the bed and I got this excruciating pain. And at that point I realized that it was more than I thought it might be. So I went to the hospital. By this time, the Abramson Cancer Center was in existence. So you could see how their cancer program at the hospital has evolved over the years. And at that point, I was told that I had esophageal cancer. Dr. Ginsburg, he gave me endoscopy, and that's when it was diagnosed. And at that point, I was like in total shock. I couldn't believe that this was happening to me a second time. But I knew that from past experience, and as the cancer program at the University of Penn Hospital had evolved, I knew that I was in good hands. And in addition to my faith and the professional expertise of the hospital, even though I was nervous and, I'm gonna be honest, scared, I knew that I was be in good hands. And it was quite a journey. I think that my second experience with cancer was basically a little more complex in terms of treatment than my first breast cancer experience. However, I received support throughout the whole experience. The day I was diagnosed with esophageal cancer, the next morning I was contacted by Trish Gambino and her staff. I went to see my oncologist, Dr. Teitelbaum, and nutritionists, and everyone was very supportive. People at the hospital that I didn't know, they were contacting me, introducing themselves to me, lending me their support, encouraging me, and letting me know that I wasn't by myself and that they would be there to support me. And there were a couple of times where I had to be hospitalized due to radiation and chemotherapy, but even with that experience, everyone was right there with me, supporting me, asking what they could do for me, putting me in touch with other healthcare professionals that specialized in the care that I needed. I never felt that I was by myself. Every time I would feel low in spirit, someone would always call me and ask me how I was doing, what can I do to help you. There was a point in time where I needed a feeding tube and infusion at home. Healthcare professionals would come out to my home, always greeted me with a smile, always were professional, treated me with dignity and respect. Got a chance to know my family members and kind of vicariously became a part of my family. It was just a good experience. Cancer can be devastating. However, with the right support and care, faith and trust in yourself to get through it, as well as healthcare professionals, you can get through it. And I can testify to that. I think it's about 18 months since I've had it, and I'm doing fine, and I continue to get support. And I just wanted to mention that I also attend a support group, and because of Trish Gambino and Karen Wagner, the nutritionist at University of Penn Hospital, I now attend a support group at Pennsylvania Hospital. And that's it.
Thank you, Gail. The next person that's going to come and tell her story is Kim Hall-Jackson.
Good morning. I too, like Gail Slappy, am very nervous, but very honored and pleased and thankful to be able to stand here today and tell you about my journey and my recovery through cancer. I was diagnosed in 2008 after seeing an unusual discharge in January 2008. After speaking to multiple doctors, because that's what I do. I talk to everybody and I do my research, and ruling out what was thought to be standard, hemorrhoids, too many tomatoes in my salad, etc. I eventually got a colonoscopy. The colonoscopy did in fact confirm that I had colorectal cancer stage 1. My colorectal surgeon was at Hahnemann. His name is Dr. Stein. Wonderful, wonderful guy, my new BFF. And had surgery after the holidays. I was told I had some time because it was stage 1. Scheduled the surgery after Kwanzaa, took the opportunity to tell my whole family about the diagnosis and tried to present an optimistic outlook for my family and my children. I am married, a mother of 6, did not want to disturb any of our traditions, and we all embraced for what we thought would be just a surgery and I'd be done. Had the surgery in February 2009. When I returned to the hospital for my 2-week staple removal and ileostomy bag check, I had a bowel resection and a temporary ileostomy, during the surgery. I was told at that time that the pathology report had restaged me for stage 3. I was devastated. I was devastated the first time. I was even more devastated the second time. So began the journey of how to deal with chemo, radiation, where to go, how to sustain the treatment, how to work, how to keep your family intact, how to tell your friends, how to tell your parents. There's really no card or no official cool announcement to say, I got cancer. So my family, my support, my faith really just kind of rolled right in really tightly. After interviewing and meeting with several doctors, I fell in love with my second BFF, Dr. Teitelbaum, and her plan of treatment and cure and her commitment to beating my disease was phenomenal. Fell in love with her, and we began the journey to treatment. Dr. Teitelbaum and my colorectal surgeon kind of disagreed about what we should do about my ileostomy bag. I wanted to remove it. They wanted me to keep it. I had decided to remove it and then begin my treatment. The ileostomy was temporary. I kept it for 8 weeks. As long as the colorectal surgeon confirmed that everything was clean and clear and there was no leakage or no holes, then we moved forward, removed it, and then I began the chemo and radiation. I believe I did 8 weeks of chemo, 8 weeks of radiation with chemo, and then another 8 weeks of chemo radiation. Basically throughout of 2009, chemo, radiation, chemo. Ever since December 2009, I've been NED, no evidence of disease, and been really, really happy. My bowel function is a little different. I probably go to the bathroom more than the average bear. I know where all the good bathrooms are in the city. Target, Trader Joe's, Whole Foods. I travel with my own toilet paper because I'm OCD and I want my own toilet paper. You know, if there's anything I want you guys to be able to take away from this experience is cancer really has a good way of alienating you. I mean, even in the midst of having your family, your support, your friends, the doctors, the nurses, practitioners, they're all fantastic. But in the middle of the night at 2 a.m. when you wake up, it's almost like a dream. It's almost like an out-of-body experience. So hold on to your faith, hold on to your family and friends. I have a wonderful, wonderful husband, Jeffrey Jackson over there, who would wake up when I tapped him on his shoulder at 2 a.m. and say, you know, is this really happening? Do I have cancer? And he'd say, yeah. He kept the jokes coming when I wore my fanny pack with the chemo treatment, and it made that sound like a Kodak. They would say cheese. We'd stop and smile. You know, I made the best of it. And throughout it all, I'm just so thankful for life. All the little petty worry things that I used to have no longer exist. Life is so important, life is so special, and I'm just thankful for the team. My team is an awesome team, and I'm just very thankful.
Beautifully stated, Kim. And our next speaker is going to be Rick Magara, and he also has a very inspiring story to tell.
I'll use the mic here because it works. Thanks, Trish. Thanks, Penn Medicine, Dr. Coachman, everybody from this fine organization for hosting this conference. This is my third or fourth conference, and it's great to be here. I met a lot of friends through this. My story goes back 15 years. I'm a 15-year cancer survivor, esophageal, stage 3. It started when I couldn't swallow one day, and I thought I was just eating too fast. So I went a couple months, didn't do anything about it. Lost about 20 pounds. My wife says, Rick, you got to go to the doctor. Something's up. So I went to the doctor. I went to a great doctor in Presbyterian, Dr. Cato. He was my primary at the time. Met him for the first time. He gave me a thorough examination, and he thought there was scar tissue based on all the heartburn I had. I used to have heartburn constantly when I was in my teens. Never thought anything about it. I took my Lana, drank a lot of milk, took over-the-counter stuff. There wasn't, good stuff available over-the-counter back then. So he says, we'll do a the upper GI that's probably scar tissue. Well, I had the upper GI done. Came back that I couldn't pass the test. The barium wouldn't go down. So I went for a follow-up endoscopy. It was done again at Presbyterian. Came back cancer. I got the call. I can't believe I got the call. I was actually at work. And can you imagine getting a call at work and the doctor telling you that you have cancer? The first thing I thought was, wow, am I going to be able to eat? Because he told me we need to take it out. We need to take your esophagus out, stretch your stomach up. But there was no big deal to him. It's no big deal to this Penn Medicine group. They do it all the time. So I went, at that time I came over to here and met my wonderful doctor, Dr. Coachman. And he did a follow-up endoscopy with an ultrasound, and then I was then scheduled for surgery. But the whole point of this, it's been 15 years, and I got through it. And I got through it because of my family. I got through it because of my church, my friends, my doctors, the nurses, the wonderful staff here. My neighborhood got together for me. It was just incredible. So when you hear that you have cancer, it's not the end of the world. You can get through this. I had a wife, beautiful wife, still do. She's not here. She helped me, thank God. She helped me through it. And I had 2 young children. I was in my 30s, but I was young enough, strong enough to handle the surgery, and then I was followed by 6 months of chemo, or 6 weeks of chemo, 6 weeks of radiation, and then another 6 weeks of chemo. I had a great doctor, an oncologist, Dr. Vaughn. My radiologist was Dr. Whittington. My surgeon, God bless him, Dr. Rosado, who just passed, saved my life. But I can't say enough about that you can get through this. If you feel depressed, then you will. I mean, come on. Somebody tells you you got cancer. I mean, you think, that's it. And so many people are afraid of that word, but don't understand that with today's modern medicine and all the support, you can get through this, especially here at Penn Medicine. It's one of the best hospitals in the world. They deal with this every day. And we're fortunate to have this hospital and this organization here around us. Some people are afraid to drive to the city. They don't want to take the long drive, the parking. Forget all that. It's well worth it. When it comes to your life, there's no better place to be, and you got to put that stuff aside. But again, you can get through this. If you have questions, don't be afraid to ask, because somebody next to you has the same question. One thing that helped me, not only have I made great friendships through it, but the esophageal support group, which I still go to, was very helpful. I enjoyed going back. I enjoyed talking to some people, letting them know, hey, look, I'm here 15 years later, and I'm doing well, thank God. But join one of those groups. Get involved, even in your own church or your own neighborhood. If there's any type of groups that meet, I'm sure that there are. The American Cancer Society has a lot of good programs. Find out. Don't just sit home and be depressed and feel sorry for yourself. You can get through this. You will get through it. Keep the faith. Love your children every chance you get, and you'll get through it. Thank you.
Thank you, Rick. Very inspirational. And our final speaker is Daryl Robinson, and he has quite a tale to tell.
Good morning, good morning. As Trish said, my name is Daryl Robinson, and I know that some of us in here are struggling with cancer, some of us are cancer survivors, but I'm gonna be honest with you, I consider myself a cancer conqueror. I don't look at it as being a survivor, I'm a cancer conqueror. I was diagnosed with GIST in February 09, which is gastrointestinal stromal tumor. Where I found out, I was at the gym one day. I'm a pretty active guy, I like to work out and do sports and things of that nature. And I was on the treadmill one day and I was feeling this pain and I couldn't breathe. Went to Jefferson, where I was originally, where my primary was. I went to Jefferson Hospital and they did some tests and they found out that I had a tumor on my liver the size of a grapefruit. And I had no symptoms. I wasn't losing weight. I didn't have any, sickness or illness or anything like that. But the tumor grew so large that it inhibited my lung from expanding all the way, and it inhibited my breathing, and it caused pain. So after having MRI and CT scan and things of that nature, they found out that I also had one on my stomach the size of a baseball. And the doctors at Jefferson told me in order for those tumors to have grown so large, I had to have had this cancer for about 3 years for it to grow so big without any symptoms and things of that nature. So here I am. I went to work on that Friday. It happened to be February 13th, a Friday the 13th. And I found out I had cancer, gastrointestinal. And so I found out that, after educating myself about it, the doctors at Jefferson wanted to do surgery right away, and they wanted to take the one that was on my liver out and then treat the one that was on my stomach. And I said it didn't make any sense. So I went, and I had a sister who works for the University of Pennsylvania Hospital in the oncology department. And I said, I've got to go get a second opinion. Well, first of all, thank God that I had that opportunity to do that, because I met some amazing individuals at the University of Pennsylvania. After coming to the University of Pennsylvania, the doctors, met Dr. Fraker and my oncologist, Dr. G. Antonio, the man. He is the man. I gotta give it up for Dr. G. He is the man. I tell you, he's a gentleman who walks softly, but is very, very compassionate and very. I find him to be very compassionate. Doctor, very humble doctor, but I never told him this, so I'm gonna say it publicly, I love you, man. Nonetheless,
And he's blushing.
he is. Nonetheless, went to Penn, and Penn said, no, that doesn't make sense, let's just treat both of them. Why go in, to have surgery, and then have to come back and have surgery again? So I just found my experience at the University of Pennsylvania Hospital so much better. And the staff, the compassion, and things of that nature. So, however, when I went to have my surgery, I had my surgery, and it was anticipated I would have surgery and I would be out in about 2 weeks. However, that didn't happen. I went and I had surgery, and I was in there for 3 months. I was in the hospital for 3 months. I had a lot of complications. I had issues with infection. I had issues with healing because I'm a diabetic also. I had issues with drainage and things of that nature. So, all of these things was wearing on me. It affected my faith, it affected my family, it affected my finances, 3 Fs. And all of those things affected me. And I have to be quite honest with you. I have a great family. I didn't even know it, but my mom and my nephew was here. So I'm glad they're here also. They showed up. I didn't even know they were going to be here, so it was good to see them. I have a great family support system. But, the pain that cancer presents, even the surgery, sometimes is minuscule to the psychological and emotional pain that you go through. And for me, that's really what happened with me. The things that cancer presented for me was, the physical aspect wasn't really that much for me because I'm a physical guy, but the emotional and psychological aspect of it really took a toll on me. I started thinking about my children, I started thinking about my grandchildren, how they would be affected, even to the point where when I was in the hospital, my oldest son only came to see me one time. Only one time. And he said, Dad, the reason why I can't come see you is because I'm not used to seeing you like this. I'm used to seeing a man who was strong and always, took care of himself and took care of me. And my son was, he was 18 at the time. And he said, and I just could not bear to see you like that. And there were nights in the hospital where family was gone, friends were gone, and I'm sitting in this sterile hospital room, cold, and I'm gonna be honest with you, there were nights where the pain was so great, the emotional pain, the physical pain was so great that I prayed for death. I asked God to please just take my life. I couldn't bear my children see me that way. I couldn't bear the pain. I couldn't bear the psychological pain and things of that nature. But however, there was a time that I came in contact with another great individual named Trish Gambino. I'm about to get emotional myself in a minute. But I came in contact with Trish Gambino, and I thank God for her life. I thank God for her sacrifice. I thank God for her dedication. I can't even put into words what God has placed in her to give to individuals like myself. And it was because of individuals like Dr. G and Trish, because they don't look at their jobs as jobs. And I have to be honest with you, I look at it, they approach their jobs as a ministry. And when you minister to individuals, you are being sincere about what they do. And because of what they do and what they've imparted into my life, and not just them, but the other staff in the oncology department, it gave me more, it gave me hope, it gave me a fight and a drive to want to live. And Trish put me in touch with other individuals and other organizations that reached out to individuals like myself and were suffering with those things that I went through. However, there was a time where I had to look at my life and say, wait a minute, I cannot let this kill me. I'm gonna live. I'm gonna fight. I'm gonna live. And most of you know that healing is just not about the physical aspect. It has a lot to do with your psyche, your state of mind. And I believe that that is most of your battle. When you are affected emotionally or physically and psychologically, your mindset has a whole lot to do with it. So I decided that I am not going to let this conquer me. I'm going to conquer it. That's why I call myself a cancer conqueror and not a survivor. And so I made it up in my mind that no matter what happened, and I had stage 4. I had stage 4 cancer. And so I made it up in my mind that no matter what time I had left, I'm going to use that time, not only to fight, but to give back. I had to fight because I thought about my grandchildren, I thought about my children. I said, you know, I'm fighting not just for myself, but I'm fighting for them. I'm fighting for my family because somebody needs me. So you have something to offer. Life is not over because of what you've been diagnosed with or what we've gone through. Life is not over. We have something to offer. You have something to offer. And we have not gone through this unpurposefully. It's a purpose for everything that we go through because somebody needs to hear your story. Somebody needs to hear what you've gone through because somebody needs to know that there is life after cancer, after being diagnosed, that there is something that you have to offer, that there is value in your life, even through the pain, the suffering, because I have to tell you, I have chronic pain, even right now, after my surgery, after 2 years of being through chemotherapy and 2 years of surgery and all of those things is still going through. I have chronic pain. I don't know if the pain will ever go away. But it's a reminder to me, the pain is a reminder to me, and I don't know if you're familiar with it, but I'm going to say it anyway. There's a story in the Bible where Paul, the Apostle Paul, talks to God, and he talks about a thorn in his side. And he talks about this thorn, and he asked and he prayed to God to take the thorn away. But God said, no, I'm not going to take that pain. And we don't know exactly what it was that Paul was talking about. But he said, I have this thorn in my side, and I asked God to take it away. And God said, no, I'm not going to take it away. So Paul says, he says, whatever state I find myself in, I find myself to be content. And it's that same thorn that kept Paul at the altar, and it's the same side that keeps me going. The same pain in my side that keeps me going and allows me to know that I'm alive. Although it's pain, it's triggering something in my life to let me know that I'm alive and that I have conquered what tried to take me out. So whatever you're going through, whatever it is, I thank God for Trish, I thank God for Dr. G, I thank God for University of Penn and the system that they have put in place for individuals like myself and the individuals on this panel that has caused me to live and to be a cancer conqueror. So thank you for this time. Thank you.
My last panelist just entered the room, Kathy. If you want to come up here. She's going to tell you her story in a few minutes, but thank you so much, Daryl, for that wonderful story. He is an inspiration, as everyone on this panel is, to all of us. So the last panelist is Kathy, who's late. Kathy, get up.
Okay, I'm sorry I'm late. I had to park 20 miles away. And I'm not kidding. Anyway, it was a long trip. My name is Catherine J. LaRue. I had esophageal cancer. 2010, I was diagnosed. In September, I had no symptoms whatsoever. I was never sick. And in September, I had trouble when I would eat. I had no trouble swallowing, but after I would eat, I would spit up. So the doctor suggested I would have a scope done. So in October, I had a scope done, and the doctor was very upset. I had a tumor in my lower esophagus, but it was stationary. I was very lucky. It didn't hit any of my organs. I was very fortunate. So then the next thing I know, I went to this one hospital, had a checkup. Didn't like the doctor. Won't say the hospital. So I ended up going to Penn. My nurse, or a primary care doctor, suggested I go to Penn. Went to Penn, and they did an ultrasound scope just to make sure, and I met with the surgeons. They explained everything to me, what they were going to do as far as removing the esophagus. So that's when I kind of teared up, got nervous. The thought of removing the esophagus made me extremely nervous. But they were very reassuring. And so, next thing you know, I had to have treatments to shrink the tumor before the surgery. So I went through chemo and radiation, shrunk the tumor down, and had surgery in April. I was in a hospital for 10 days. That was a joy. It was a little rough the first 4 days. Had tubes out of me and everything. But I want to tell you, the nurses in the thoracic center were fabulous. The doctors I had were fabulous. I can't say anything wrong about any of them. One nurse I had, she was only 23 years old. She was like the best. She reminded me of Fran Drescher from Nanny and the Professor. She would come in every day and go, "How you doing? You feel okay?" "Yeah, I'm fine. Can I do anything now?" "All right." And she was adorable. Her and this male nurse, Dan. All the nurses were great, but these two were fabulous. They took excellent care of me. I couldn't want for anything. And the thoracic center, I want to tell you, they were fabulous. I just have nothing bad to say. I was very fortunate to have such good care. So then I got out of the hospital. So 3 months later, you have a PET scan. 3 months later, I find out I have cancer again. Same cancer, went up higher to my throat. So I had to have treatments again. But it was more aggressive treatments this time. The radiation was aggressive radiation. It was a little bit rough, but it was okay. I had to do the feeding tube. Well, before that, I was doing the feeding tube before the operation. And what happened, I have to tell you, this is really funny. I got tired of doing the feeding tube. I thought, I am not doing this with these cans that you have to pour in this plastic bag and plug in. It was making me sick, so I started eating. So the last 3 weeks of radiation, they say usually you don't eat. Well, I was the opposite. Of course, I'm the opposite of everything. So I started eating. So you have to flush the tube out even if you're not using it. So I was flushing the tube out one day, 3 weeks before my radiation was done. And I'm standing there at the sink, and all of a sudden I feel this water running. I think, oh my gosh, I have no feeling. Did I wet myself? I think, what is this? I looked, the feeding tube's in my hand. I guess I pulled it out and don't know it. So I call, and they go, oh, you gotta put it back in, you won't be able to eat, this and that. I thought, I'm eating. I'm not using the can. I haven't used it in 3 weeks, these cans. I hate that. So they made an appointment. I have to put it back in the next day. So I thought about it. I thought, I'm not doing it. So I called to cancel the appointment. So the doctor called me. He goes, cancel that appointment. I said, I already did. He goes, good girl. So I was very fortunate. I was eating. So then I had the surgery, and they had a feeding tube in me, just in case I have trouble eating after surgery. Well, after surgery, The first day, I ate. And I continued to eat. And I never stopped eating. I don't know, I can't even stop. I eat every 2 hours. I mean, it's ridiculous, stuff I eat. I mean, I'm always eating. I'm always hungry. Always hungry. I'll eat and then 2 hours later, oh, what can I eat? I eat a lot of healthy foods. I'm not going to say I don't. I do eat very little meat now, but I don't know. My system's changed, so I can eat a little bit of turkey, maybe chicken, but I can't eat a lot of meat. I eat a lot of vegetables and a lot of fruit, a lot of organic stuff. I do eat organic soups and stuff like that. But I'm always eating. Always. I mean, I already ate. I'm not even going to tell you what I ate already this morning. And about an hour from now, I'll be hungry again. But anyway, I'm very fortunate at Penn University, fabulous hospital. Can't say anything wrong. I've had nothing but the best care. And I met a lot of special people in my life through this. And Trish, she's been a super, super great person. Has helped me a lot in many ways. And who calls you and wishes you a happy birthday? Trish. Called and wished me a happy birthday. I thought, who does that from a hospital? I thought that was fabulous, you know? So anyway, I had a PET scan. I'm cancer-free right now. Hopefully it'll stay that way. But I'm a very stubborn, determined person, too. I'm not going to say it wasn't easy. I mean, there's times I've cried and said, why me? Of course, you know, I'm crying, why me? I feel sorry for myself. For about 5 minutes, and I thought, I can't feel sorry for myself because it's going to destroy me. So I snap out of it and keep going. So I've never stopped moving since day one. I forced myself to get up every morning and do my hair and makeup every single day for every treatment. I always had my hair and makeup done because that's what kept me going, is looking nice and presentable. And a good friend of mine, Jean, which I'll embarrass her, she took me to every appointment. Now, what friend does that? Monday through Friday, she drove me. She wouldn't let me drive. She took me to every doctor's appointment. She was a good support system for me. And it's good to have at least one person to really be with you and help you through this. I think it makes a big difference. So, thank you for listening to my story, and I'm very lucky. Thank you.
So I really think that this has been a wonderful confirmation of what you can do once you are diagnosed with cancer and how you can move forward in your lives. I think do we have time for a few questions? Does anybody have a few questions they'd like to ask of our panelists? We're here to address them.
A friend of mine had colorectal screening done at another major hospital in Philadelphia. She said when they did it, it felt like a tractor rode through you. So I know much better, much better. I think University of Pennsylvania Medical Center are the best in the universe. And I worked at Independence because that personal choice PPO, that way you can see doctors at different hospitals. I think it's important to see the best doctors. And the reason I've lost all my jobs since 2000 were basically healthcare costs. That's why employers really get rid of their employees. But attorneys all across employment that deal with employers help and firms to come up with excuses so they could get away with it. But I have much less conditions, but I'm going to find about the colorectal screening for people who don't have the cost of it. Because I'm sorry, but I've been homeless since July last year. Chapter 7 bankruptcy, a big part of it. Also, far less health conditions, but University of Pennsylvania, back when I did have insurance worked at Blue Cross, they did colorectal screening because I no longer have diverticulosis, but an antimine died of colon cancer long ago, but that puts you at risk for it. And the University of Pennsylvania said just June 2012, they wanted to redo that test. He's going to find out about that.
Okay. Well, we can, and also we can address that more. If you'd like to come up and talk to me about it, we can talk a little bit more about it. Okay. Thank you for sharing.
I think the point raised is a real good one in that colon cancer screening is absolutely critical, especially early recognition of people who are at risk for cancers and early recognition of the signs and symptoms. I think you heard very nicely from Rick a little while ago that he was a teenager who had reflux. And one of the leading causes of esophageal cancer, specifically esophageal adenocarcinoma, is Barrett's esophagus, which is an acquired condition from reflux damage to the esophagus, which a lot of people have, but as time goes on, some of the symptoms will go away, but that's because of the maladaptive response of the esophagus to the reflux. So it gives a false sense of assurance that the problem's gone away when indeed the precancerous condition, the Barrett's, is there. And we have ways to look for that, screen for that, and we actually have some highly effective ways to eliminate the Barrett's and eliminate the risk of the cancer going forward. Okay, I'd like to thank everybody, and we're going to move on to the next session. All the panelists have said they'll make themselves available for any individual questions. Thank you. Our next session is going to be an overview of oncolink.org. Maggie Hampshire is going to come up and lead us through this. Hopefully we have the computer all set up and ready to go.
Great. Well, that's a tough act to follow. We love you, Trishy G. I just wanted to talk about OncoLink, which is a cancer information resource available from the Abramson Cancer Center. Lots of your docs and nurses write for OncoLink, and it's what takes me away from all of you guys right there. Hey. So if you're looking for reliable information on the internet, you should try to look at OncoLink. Oh, fancy slides. OncoLink is the first information website on the internet. It started before Yahoo, before Microsoft, before any of that. We're going to be 18 years old this year, full-grown adult. It started in 1994 by another Penn radiation oncologist, and now is run by Dr. Metz, who lots of you know. All the content, like I said, is written by Penn nurses and doctors, so it's very reliable content. We don't use medical writers, not that medical writers aren't good, but we're all taking care of you, and what we learn from you, we put on the internet so that other people can get help. It's free, there's no registration. Who should use OncoLink? Everyone. So people who have cancer, friends and family, healthcare professionals, anyone in the general public. We have lots of users nationwide. It's not just a Penn resource. There's resources for all over the world. So if you have friends anywhere else, it's also translated into Spanish by a native-speaking nurse who works over in Camden and has been working with us for years. So a few resources on OncoLink. If you have been there before, you might notice now that we have changed OncoLink. It's a new look and feel. We try to make it easier for you guys to find the information you want. One thing we do is called OncoPilot, and that was inspired by many of you. So when you first get diagnosed with a cancer, you have a lot of questions and you need to know where to go right away. So we wrote articles about finding an oncologist, getting a second opinion, preparing for your first visit, questions to ask, good questions to ask your doctor, that's available. And there's printable logs. You can track your appointments. I know it's hard to keep track of everything when we have you going with so many treatments. So you can print logs for your appointments, your doctors, your medications, your radiation, all of that's available there. Another resource we have is called the Livestrong Care Plan. So that was created by folks at OncoLink, Carolyn and Gloria mainly, and Dr. Metz, who are really interested in survivorship, and that's why you're all here. So after you finish treatment, which is a lot of you who have finished, you can go online and fill out one of these on your own. There's a lot of side effects that happen from the treatments that we give you, not just your cancer. And so this is a plan to navigate your life after that cancer. So you can learn about possible long-term effects, healthy living for cancer survivors, and resources for dealing with lots of issues related to employment and psychosocial issues. Another thing we have is called What's My Risk? Now, this is for people who have not had cancer. This is for your friends and family members who are here to support you but are thinking, why not me? Well, why didn't I get cancer? Or what can I do to prevent cancer? So this is another tool that we have. It's available. It's free on Oncolink. Anyone can go on and fill it out if you have not had cancer. You go through and you fill out some questions. It takes about 10 minutes. It's very detailed about social habits, exposures. It's about modifiable risks, really. So, you might have a risk of cancer because you have a family member with cancer, but there's lots of things that you can do to decrease your risk. So when you fill this out, you get a report of what type of cancer you're at risk for and what you can do to help yourself to prevent it. And that's it. Those are the resources available on Oncolink, and if you need to take it, take a look. We're available here today, and we're also doing live live-from care plans if you want them. Thank you.